Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Pharmacy Medicine. In today's video, we will continue with metallic poisons. In that, we will discuss about lead poisoning. Like any other heavy metal poisons, lead is also poisonous, and metallic form of lead, though it is metallic, is poisonous compared to other metallic poisons which are not poisonous. As the only salt form of metallic poisons are poisonous, but lead, its purest form also poisonous, and is also salts also poisonous. It appears mainly as heavy steel grey metal. It is used in storage batteries, shoulders of welding, paints like in toys they used to use in older days, paints of walls they also used in older days, hair dyes, electric cable insulations, pottery industry, ceramics and petrols also were leaded. Nowadays they have removed that because of its poisonous properties. That is a typical cumulative poison. So it gets accumulated in the body as days progresses, and it causes poisonous effects. So chronic poisoning is more common with lead than acute poisoning. Coming to poisonous compounds, lead acetate is also known as sugar of lead. It appears as a white crystals. Lead carbonate, also known as safeda, is a white crystalline powder. Red chromate, it appears as a bright yellow powder. Lead monoxide, it appears as a pale brick red or pale orange masses. Lead tetroxide, it is also red lead or vermilion or sindoor. Again, it was used by Hindu women as a form of sindoor, as a form of Hindu tilak in the forehead. Nowadays, it is again been removed. It appears as a scarlet crystalline powders. And lead sulfide, which is the least toxic form of lead. Coming to mechanism of actions, as any metallic poisons, again it interacts with sulfurated group and interferes with the extension of enzymes necessary for heme synthesis. Mainly, lead acts on the heme synthesis and interferes with red blood cells and for hemoglobin and cytochrome production. It interferes with mitochondrial oxidative phosphorylation, ATPases, calcium dependent messengers, and enhances oxidation. This leads to cell apoptosis, that is cell death, and also hemolysis. So mainly because of it interferes with all these enzymes, there is cell death of different organs, and majority of action is seen in the form of hemolysis and RBC, death of RBCs. Coming to signs and symptoms, mainly acute poisoning of lead. When the person consumes, there is astringent metallic taste, dry throat, thirst, burning abdominal pain, and any other poison there is nausea, vomiting, stomachs, sometimes diarrhea is present. Then peripheral circulatory collapse occurs. The person may experience headache, insomnia, paresthesia, depression, which may again lead to coma and death. Cerebral ataxia is more common in children compared to adults. Fatal dose of lead, but 20 gram of lead acetate and 40 gram of lead carbonate are fatal. 1 to 2 days is fatal period for lead. Coming to treatment, as any other poisonings, first gastric lavage should be done. So this again is included with gastric lavage, 1% solution of sodium or magnesium sulfide is used. This combined with lead forms insoluble lead sulfide, which is excreted after it will be interacted. Then demolisses to prevent absorption of lead. So demolisses forms a coating on the abdomen and prevents the absorption. Then combination of BA and calcium disodium varsinate or DMSA is effective as a form of chelating agent. Then penicillamine again is form of chelation, it is used. Calcium chloride 5 mg, 5 to 10% solution IV causes deposition of lead in the skeleton from the blood. So it moves lead from blood to bones. So in bones it get deposited, and after longer duration it get excreted. Then peritoneal hemodialysis or hemodialysis is done to remove any unabsorbed lead. Then symptomatic treatment is preferable. So acute poisoning, again it is followed the usual trend of gastric lavage with specific chelation therapy. Then symptomatic treatment is done. Coming to postmortem changes, so signs of acute gastritis are typically seen. There is no any typical findings particular to lead is there is no findings are there. Only is changes are there is mucosa of stomach may show thickened and softened with eroded patches and may be covered with grayish white deposits. Other than that, there is no specific changes is seen. Coming to chronic poisonings, so this is the one which is important, and this is the one which is commonly seen in lead poisoning. So chronic poisoning of lead is also known as plumbism, saturnism. Chronic poisoning results from daily intake of 1 to 2 milligram of lead. So, any person who consumes 1 to 2 milligram of lead daily may lead to chronic poisoning. So, there may be different ways of chronic poisoning. One is inhalation of lead dust and fumes by makers of white lead and makers of users of lead paints, like in children's who they consume twice. So, because of twice chewing of twice, they used to get poisoned. Smelters, plumbers, glass polishers, printers, enamel workers, glass blowers are also exposed to lead vapors. Usually, lead vapors are more poisonous than lead salts. The amount of lead is from drinking water, so stored in lead cisterns, from tinned food contaminated with lead from other soldiers, and from constant use of hair dyes and cosmetic containing lead. Then absorption through raw or intact skin is also possible. Use of geese stored in brass or copper vessels lined inside with tin in which oleate of lead is formed, and also by taking food and cooked in tin vessels is also one may lead to poisoning by lead. Absorption of vermilion applied to the scalp, again this has been now only cheap available lead of the poor person who does not know about that may lead to poisoning by lead. Children can be chronically poisoned through chewing of licking of toys, walls, furnitures, etc. painted with lead based compounds. Again, paints are nowadays are lead free, but in olden days they used to contain lead, but nowadays all the paints and toys are lead free. Coming to signs symptoms. So, signs and symptoms includes first is the facial pallor. So, facial pallor again because of hemolysis it may present, particularly about mouth is seen in earlier symptoms are most consistent sign. It may be due to because of vasospasm. Then there may be anemia. So, anemia then because anemia there may be polycythemia with polychromatophilia in early stages, but later there may also with polychromasia, punctured basophilia, reticulocytosis, poikilocytosis, aneuplocytosis, nucleated red cells, sideroblast, and an increased amount of mononuclear cells, whereas polymorphonuclear cells and platelets are decreased. So, WBCs and platelets are decreased, but RBCs, their abnormal cells are present with basophilus stippling in the nuclei, absence of minute or abnormal nucleuses are seen, like poikilocytosis and aneuplocytosis are seen. The anemia is probably due to decreased survival time of red blood cells and inhibition of heme synthesis. So, early development of RBCs are interfered by lead, and heme synthesis is also interfered, leading to different abnormal RBCs, and incorporation of iron is also decreased leading to porphyrin decrease in heme, leading to ultimately anemia. Then third is the lead line formation. There is a stippled blue liner which are called as Bertillon lines seen on the gums in 50 to 70% of cases of lead poisoning. It occurs due to subepithelial deposits of granules at the junction with the teeth. So, near the junction of teeth with the gums, there is deposition of granules of lead, which is the blue line, like a blue line deposition will be seen near the gums at the base of the teeth. Within a week of exposure, especially in the upper jaws, they are typically seen. It is due to formation of lead sulfide by the action of hydrogen sulfide formed by decomposed food in the mouth. So, when lead combines with the hydrogen sulfide in the mouth, they form lead sulfide, which get deposited in the tooth and gums near the gums, leading to Bertillon lines. A similar blue line may also be seen in poisoning by mercury, copper, bismuth, iron, and silver. Then colic and constipations. It is usually a later symptoms. Colic of intestinal ureters and blood vessels occur in about 85% of cases. Individual attacks last only for a few minutes but may recur for several days or weeks. Constipation usually, but diarrhea and vomiting may occur. Then there is lead palsy. When nerve damage starts occurring, lead palsy occurs. It occurs usually late and is seen in the less than 10% of cases. There may be tremors, numbness, hyperesthesia, cramps before the actual muscle weakness. Usually the extensor muscles of the wrist will lead to wrist drop when the radial nerve is affected. Then maybe deltoid biceps anterior tibia now may be affected, leading to foot drop, and rarely muscles of the eyes or intersecting muscles of the hand or foot are also affected. The palsy is associated with degeneration of the nerves and atrophy of muscles. So, when muscles and nerves get damaged, that occurs, then degeneration of nerves leads to palsies. So based on which nerve were affected, the symptoms occurs like wrist drop or foot drop may seen. Then encephalopathy. So it is present in almost every cases of plumbism, common in children often associated with tetraethyl lead. The symptoms are vomiting, headache, insomnia, visual disturbances, irritability, restlessness, delirium, hallucinations, convergence, coma, and death. Lead encephalopathy usually is irreversible and almost in about 85% have permanent brain damage occurs. Death occurs in about 25% of cases who have encephalopathy. Then cardiovascular system, lead causes vascular constriction leading to hypertension and permanent arterial degenerations. Chronic arteriosclerotic nephritis and intestinal nephritis occurs in the kidneys. In reproductive system, menstrual derangements such as amenorrhea, dysmenorrhea, menorrhagia, sterility, and abortions are frequently seen. Abortion may occur in pregnant women in 3 to 6 months. Women can also experience abortion. Other systems, there may be dyspepsia, anorexia, emaciation, general weakness, exhaustion, irritability, foul breath, headache, vertigo, loss of hair, and drowsiness. Peripheral neuritis also is rare. Retinal stippling is noticed in ophthalmoscopic examination, showing presence of grayish glistening lead particles in early phases of poisoning may be seen. Coming to diagnosis of lead poisoning, first mainly the history. So history of exposure. So if the person is exposed to working in the lead industry, or there is a history of that child consuming some toys or balls, eating some toys or balls, or farm history should be thoroughly taken to know whether there is exposure is present. Then clinical features, though not symptomatic, but they are there like lead line, encephalopathy, colic pains, all indicative of lead poisoning. Then X-ray evidence of increased radiopaque bonds or lines at the metaphysis of long bones and along margins of iliac crest is seen in children. So in children, if they are exposed to lead, then deposit of lead forms radiopaque bonds or lines is seen. In erythrocytes, photophyrin commonly assayed as zinc photophyrin usually below 35 microgram per liter is not sufficiently sensitive at low blood levels. It is not specific for lead. Then basophilic stippling is also seen. X-ray may show radiopaque materials in GI tract if lead is ingested during proceeding of 30 to 36 to 48 hours. Porphyrinuria, mainly due to choroporphyrin 3, is a valuable screening test. In the blood levels more than 20 microgram percent and is even 150 microgram per liter is diagnostic of lead. Coming to prophylaxis, to prevent chronic lead poisoning, mainly the person has to maintain a proper ventilation practice, maintain proper hygiene of workers, and periodical medical examination. A diet rich in calcium is connected. So diet combines with prevents the lead deposition and excretion of lead. Small amount of sulfuric acid in water. Again, this is helpful to eliminate lead since it forms lead sulfate, which is easily unabsorbed and excreted. Then weak saline purgative is given to remove any positives of lead. Coming to treatment, in severe acute poisoning with encephalopathy, BAL calcium sodium ADTA is given in combinations in prescribed dosage. The number regimen is continued until patient is asymptomatic and can tolerate oral chelation and depenicillin or DMSA is given. Severe poisoning without encephalopathy, where blood levels is more than 70 microgram per 100 ml, BAL EDTA which is given, and afterwards BAL is discontinued and blood levels fall below 40 microgram per 100 ml, but continue EDTA for 5 more days. Then oral chelation is continued until the blood levels falls below 50 microgram per 100 for 3 months. Moderate poisoning where blood level is between 45 to 75 microgram per 100 ml, EDTA 50 mg per kg per day is given. When blood level falls below 40 microgram per 100 ml, oral chelation is started. Mild poisoning when blood level is less than 20 to 35 microgram per 100 ml, depenicillin and DMSA succimer is given for the form of chelation. Supportive measures, thiamine to improve neurological manifestation, calcium gluconate for colic pain, magnesium sodium sulfate changes the lead salt to highly insoluble lead sulfate for excretion. Calcium arsenate for disodium acts as an ion exchanger in which the calcium is exchanged for heavy metal ion and a soluble stable and unionized chelate of lead is formed which is excreted. BAL 4 mg per kg of body weight every 4 hours is useful. BH alerts lead both intracellularly as well as extracellularly. Penicillamine 0.3 to 0.5 gram orally once 5 times daily effective in excretion of circuiting lead but is not as effective as EDTA. DMSA is superior to EDTA. A diet poor in calcium and ammonium chloride 1 gram per 10 times daily is given. By this, lead deposited in the bones is mobilized into blood and excreted. Then symptoms as per symptomatic general line supportive measures is provided. Postmortem appearance in chronic poisoning. Again, they are not specific, they are not constant, there is no specific changes are seen. Blue line may be seen, but line may be present. Pallid muscles show fatty degeneration. Stomach and intestine may show ulcerative or hemorrhagic changes and are contracted or thickened. Liver and kidneys are contracted. The brain is very pale and greatly swollen. The heart may show hypertrophy and there may be trauma of aorta and aortic valves. Bone marrow may show hyperplasia of leukoblast, erythroblast, and with decrease in fat cells. Segmented demyelination of peripheral nerve cells may also be seen. Cause of death in acute poisoning, death is due to gastroenteritis and subsequent shock. In chronic cases, malnutrition, recurrent infections, failure of liver functions, respiratory failure, renal failure, or encephalopathy. So, multi-organ failures are seen in lead poisoning and person may die. Acute poisoning may lead to gastroenteritis and ultimately leading to shock and death. Coming to absorption of lead, lead can be absorbed from any part of the body. Lead is inorganic lead compounds from digestive tract is slow, but it increases by inhalation. Absorbed from skin is poor. Tetrahedral lead and other alkylated compounds are absorbed from skin. Bullets or pellets lodged in joints, peritoneum, pericardium, and other soft tissues may result in lead poisoning. This was one of the reasons of death in cases of World War II victims. Survivors of who have lead bullet inside the body which lead to lead poisoning. Accumulation and toxicity occurs if more than 0.1 milligram per day is absorbed. Half-life is about 32 years in bones and 7 years in kidneys. Distribution lead is normally present in almost all tissues. Lead, it is typically cumulative poison and accumulated in all the parts of the body. In poisoning, liver, kidney, and spleen among other soft tissues showed highest concentration. The bones contains large amounts and also hairs and nails. Lead crosses the placenta and can also be present in the children's fetus. The major portion of lead in blood is found in the red cells. Lead is drawn to those areas of skeleton that are growing most rapidly, such as femur, tibia, and radius. Dense transverse lines and lead lines extending across the metaphysis of the bones and electricity is significant. So, in any bones, there may be transverse lines may be present where it get deposited. That is growing end of any growing end of the bone that get deposited showing as lead lines. Lead lines seen on X-rays has densities are due to hypermineralization. The width of red line indicates the related to duration of exposure. So, the amount of width indicates the amount they are exposed. Excretion, absorbed lead is excreted mostly in urine and also from epithelial tissues and sweat. Urine excretion rate is below 80 microgram per day, which is normal. To test the lead presence of lead, any solution is added with HCl, hydrochloric acid, which produces white precipitate. White precipitate is produced which is soluble in water on crystallizes of cooling. So, that is one of the test. So, solution is added with H chloride which causes white precipitate, which on adding to water causes crystallization cooling. Coming to circumstances of poisoning molecular importance. So, as I mentioned, lead is acute poisoning is very rare. Chronic poisoning is more common and is regarded as the industrial disease. So, industrial form of industrial poisoning occurs. Homicide poisoning is also rare. Accidental chronic poisoning occurs in workers with metal. Homicide poisoning occurs mainly if the person chronically feeds the person with small amounts of lead. It is not used for suicide again. Disulfide paste, which is lead oleate, or red lead again, which was previously used as a form of vermilion or sindoor, is used locally for abortion. Red lead is sometimes used alone or mixed with arsenic as a kettle poison. Lead missiles containing embedded in the tissue due to gunshot injuries may produce poisonous symptoms. In 12 to 48 days, the person may experience lead poisoning. These are my references.